Let's now turn our attention to health. For persons who reside in hard-to-reach communities with little or no access to quality health care, the Lagos State government is introducing an integrated solution to address health emergencies on waterways and in communities along the coastline. This integrated solution is a floating clinic at the Lagos Jetty in Falomo, Ikoyi area of Lagos. Sarah Ayeko reports.
For residents in Ilashe, Igbo-Ologun and communities along the Lagos coastline, access to quality healthcare is still a tall order. With this in mind, Governor Babajide Sanwo-Olu's administration has launched a floating clinic boat to increase access to prompt, qualitative and efficient healthcare services for medical emergencies in waterways and medical outreach in riverine communities.
It is mainly to deal with emergencies on water, but to also provide outreach services to riverine communities. And one of the first tasks that this boat will be doing is the measles, to join us in the measles campaign that has just commenced in Lagos State, to ensure that we can take the measles vaccine and other vaccines, even the COVID vaccine, to riverine areas.
This initiative is born out of a partnership between Lagos State Waterways Authority and the Ministry of Health. LASWA is providing the boat, the crew and gas to run the boat, while the Ministry of Health will provide the human resources and medical consumables. The clinic boat is expected to have 4 sections: the wheelhouse, observation room, doctor's office and nurse's station.
There is definitely an intention to expand our ambulance service, our ambulance boats, even our MICs, our mobile intensive care units, our transport ambulances. We're going to scale them all up. But yes, we're starting with 1 boat and then we will acquire additional boats.
Most people have the impression that Lagos is a completely urban city. But for us, we also realize that Lagos has a lot of communities that are along the waterways. It's a big plan to ensure that the whole of Lagos is covered. But this is the first, and so it will be located here for now.
Although the waterways could be a difficult terrain for medical personnel, the Waterways Authority assures residents and health workers of safety on the waterways.
What we're going to do is have our own core emergency and response boats, along with the jet ski, and along with now soon to be launched control room, which will be launched next month or in about 2 months from now. So this is just going to be one of those initiatives which is going to plug into that emergency and rescue service.
The Lagos Lagoon is host to many communities with little or no access to quality healthcare. The floating clinic might just be a game changer, serving health solutions to these communities if sustained. Sarah Ayeko, TVC News, Lagos.
Like in Lagos, Abuja and some other states, long queues are starting to resurface in Port Harcourt City as the fear of scarcity spreads across Rivers State. Some petrol stations are now selling above the official pump price of 165 naira per litre. Senior reporter Uchi Okoro has more.
A few months ago, Rivers State experienced a severe case of fuel scarcity that forced most petrol stations to shut down or dispense the product for as high as 250 naira per litre. Now, the number of vehicles lining up to purchase fuel at the same location and many others across the city is steadily rising. This is one of the few stations selling the product at 165 naira per litre.
This was not my experience previously. We were just buying as we go. Everyone was just waiting for customers to come in, but this morning, a lot of queue up is building up.
Majority of the fuel stations are locked up, and some of them are adjusting their meter. I think by tomorrow, that's when we'll start feeling it.
The Independent Petroleum Marketers Association of Nigeria blames the latest scarcity and price hike on the federal government's failure to close the supply gap.
Marketers were buying this product from the tank farms at 161 naira 50 kobo, as against 148 naira 17 kobo being the regulated price. And it's not every marketer may be able to source this product at that price, and that's why you see some stations short. If my members doesn't find joy in selling above the government price, but whereby they source this product above government price, To remain in business, you will sell above the regulated price as well.
Ipman predicts that the situation may worsen in Rivers State and spread to other cities if nothing is done fast.
It's only when all the depots can offer this product and at the regulated prices. Otherwise, it's only a matter of days. We will start experiencing the same thing that is happening in Lagos and Abuja in Port Harcourt.
The inevitable was apparently being delayed as residents of Port Harcourt witnessed another round of fuel scarcity in other cities. But the next few days will tell if the situation has eventually hit this part of the country or if what we're experiencing now is simply panic buying. Uche Okoro, TVC News, Port Harcourt.
Now, Borno, Babagana Zulum has directed the State Ministry of Health and Human Services to employ 40 indigenous medical doctors who studied from various institutions within and outside Nigeria. This is expected to bridge the deficit in the healthcare sector of the state. TVC News' Jesse Tafida reports.
The 12-year Boko Haram insurgency in Borno has resulted in the destruction of about 60% of the state healthcare sector. This cost about 1 million people losing access to quality healthcare services. Yet, improving access to quality healthcare delivery in Borno remains one of the top priorities of the Zulum administration. Now, the governor is hosting fresh medical graduates from Egypt, Sudan and Nigeria at the Government House, Maiduguri. Governor Babagana Zulum disclosed that recruiting the medical doctors will go a long way in enhancing standard healthcare services to people of the state.
Government has already closed the gap in terms of salaries between the states and the federal government. I will provide the funding needed to ensure the immediate take-up of the postgraduate training in the areas of setting.
The fresh graduates are urged to put in their best towards uplifting the healthcare sector in the state.
For those that are willing to accept appointments from the state government, inshallah, I will give you a guarantee to ensure that your remunerations are being paid as at when due. Rest assured that our support. But the most important thing is your mindset. You will set your mind that you work with us. Inshallah, succeed.
About 40 of them who have applied to work with the state government. Some of them are among students that were sent to Sudan by the state government.
The state government pledges to create an enabling working environment to healthcare workers in the state to effectively carry out their duties. Jesse Tafida, TVC News, Maiduguri.